There's something else that's going on, in my opinion, as to how the market is actually going to deliver these services. And I would call that an integrated health management program. The integrated health management program would take the various areas that we talked about, the building blocks plus many more areas of wellness and prevention, disease management, the account balances, all those different areas. They might be provided by a single vendor, an insurance carrier. One of the big national insurance carriers, for example, I believe see themselves as this integrator of all these different services. But for many employers, they want a carrier agnostic system so that the data that's retained out of all these different segments of healthcare are retained and are under their control and their ownership. So if they were to change carriers, they wouldn't lose that data. So the model that I've shown here is more of a carrier agnostic model, as I'll describe it, but it very well could be that the carrier is also the general manager or the health plan integrator that's at the top of this new king of the mountain model. But at the bottom, there are various networks. Let the carriers do what they do best. Put together networks, negotiate reimbursement rates, do some provider oversight, check for quality and access to care. And as you work your way up, there can be best of practice vendors in each of these segments. It might be that some of these services are done by one or more vendors. But ultimately, where I see the model developing is that each of the vendors, whether it's one or many, will feed into, through an appropriate interface, into a data warehouse. The data warehouse will have information on each of the segments and have the metrics or the measurements that we want to have as to what is success and what's not success for each of these different segments. The role of the general manager over the top of this pyramid is to take that data and turn it into real information. What's working, what's not working. Your disease management program isn't working because you don't have enough people engaged or involved in it, because you're not giving enough of an incentive. So the general manager comes back and says you need to increase the reward or incentive for that participation. And then monitors whether or not you actually get more people engaged in a diabetes program or other areas of your disease management focus. The general manager might also take the data and analyze it and say, you know, we're not getting enough wellness activity. People aren't taking care of themselves. We don't have people taking their physicals or doing their screening tests, and we need to have more of an emphasis on that. We need to have a campaign for an entire year of emphasizing and re-emphasizing the availability of screenings for cancer or diabetes or congestive heart failure. We need to get people to engage in filling out a health risk appraisal that profiles them so we know what the population needs are. And so the general manager would be analyzing that data constantly to make improvements in the program. So there's a constant cycle of continuous improvement of taking the data, analyzing it, making recommendations and changes. And every employer out there is going to be different. Every employer's incentives for their populations may be different. And so the answers to any single question can have multiple answers depending upon the culture of your organization, the education, the communication, the management support, the employee understanding of any of these options, and how many options and what options are offered. So it's a very individualized corporate structure to get to the answers to change the real behaviors that you have in place.